Let's talk about paracetamol and ibuprofen, and yeah, let's talk about how they work, what are the difference, and when we can use them together, and when we cannot use them, and which one would be better. So first of all, we already know that paracetamol and ibuprofen are commonly used over-the-counter available pain relief. They can help to relieve mild to moderate pain, but it may not helpful in a very, very severe, strong pain. In that case, you have to see the doctor, yeah? So how do they do what they do, right? Paracetamol and ibuprofen, since they are painkiller, the actual mechanism of action is quite complicated, but in simple terms, so what happens is if our body, for example, has gone through a very painful experience, or if we have injured our body internally or externally, so our body kind of have its own protection, and it will release chemical, right? It will release this chemical to make us feel pain, so that we will actually kind of take action to stop that pain. So pain is in natural sense, it's a protective protective mechanism in our body. But since pain is an unpleasant feeling, we don't want to feel the pain. So this paracetamol and ibuprofen kind of block or inhibit this chemical to release in our body, so that we don't feel the pain, right? That's how it works in like simple sense. So what are the difference? The paracetamol and ibuprofen, the difference is that paracetamol actually can help in to relieve the pain, and then ibuprofen has an additional effect, that is it is also an anti-inflammatory action. It has actually so anti-inflammatory action is an action where it kind of helps to relieve the pain as well as swelling, as well as if you have a injured part of your body, and if you have swelling as well as redness, fever, it's kind of like warm feeling to that affected area. So it kind of means that you have inflammation as well. So in that case, ibuprofen will do better, right? So that's the little bit different between the paracetamol and ibuprofen. So when to take it, yeah? So if you have like a pain and you don't have inflammation, then paracetamol will do the job. In that case, what you can do is you can take 1 or 2 tablets every 4 to 6 hours, right? So make sure that you don't take more than 8 tablets a day, because paracetamol, even though it's very safe, but it can cause your liver toxicity. So never ever take more than 8 tablets a day. But then sometimes what happens is I come across patients who come to our pharmacy, and they were like, I took 1 paracetamol, it doesn't help, and give me something stronger painkiller. So in that case, I'm like, well, I would suggest to actually increase the dose of paracetamol. You have to take the maximum, not necessarily maximum, but actual dose, not like a 1 or 2. You can actually take 1 or 2 every 4 to 6 hours for shortest period of time, that is around 3 to 5 days. So that is better than actually taking a stronger painkiller which you think will do the job. In actual sense, you only need to increase the dose of paracetamol. So that's what I would recommend, like take the proper dose of paracetamol first, and even if after taking the like a proper maximum dose of paracetamol, and if it doesn't work, then only you can switch to like ibuprofen or any other stronger painkiller. Then in that case, it will be like more beneficial and may help you, right? And that's one thing. But well, if you have pain as well as inflammation, then you can take ibuprofen. And ibuprofen has a different dose, little bit different dose. It is that you have to take 1 or 2 tablets every 6 to 8 hours instead of 4 to 6 hours, yeah, which was for the paracetamol. So ibuprofen has a different, there are different doses available over the counter. The maximum dose available is 400 milligrams. So you can take 400 milligrams 3 times a day. Right, that's the dose for the ibuprofen. And for the kids, paracetamol and ibuprofen, both of them are safe in kids, and they are available both in tablet as well as liquid form, as well as for the paracetamol is also available in a chewable form, right? And the liquid form has a different flavor as well. So if the kids has a fever, pain, and there's no injury and no inflammation at all, then just stick to the paracetamol. And then if there is, like I say, if there's inflammation, then you can switch to the ibuprofen, right? And then some cases, what happens is if you need to use them together, you can use them together as well. So if you use them together, it kind of gives you the more effect, right? So in the medications, there is a phenomenon which is called synergistic effect. So this is an effect where sometimes when you give the medication together, so both of together will kind of increase the benefit of both. So it's like literally like instead of 1 plus 1 is equal to 2, it's gonna be like 1 plus 1 is equal to 3. So that is the synergistic effect, right? So if we kind of give the paracetamol and ibuprofen together, it will increase the effect of both of the medication. So you can take together as well, right? That's one thing. So which one is better? So paracetamol will be safer. That's what I would say. And it is safe in the kids, it's safe in the breastfeeding, it's safe in the pregnancy, it's safe in adult for sure. But a little bit red flag about paracetamol is that it can cause liver toxicity. So you have to be careful not to overdose it. Never overdose, of course, and everything in the world, if you take more, is a poison anyway, right? So paracetamol is safe, but you can't take more than 8 tablets a day, otherwise it can cause you liver toxicity. And all the painkillers are only for short term and not meant to use long term. Okay, and that is one thing. So ibuprofen it is safe in the kids, it is safe in the breastfeeding, but it's not safe in the pregnancy. So if you are pregnant, ibuprofen is no, it is not safe. So in that case, you have to go to paracetamol. If you have a pain, paracetamol is the drug of choice. And when you cannot use it, you can't use this paracetamol and ibuprofen or this kind of painkiller if you have nerve pain. So if you have a nerve pain, this kind of painkiller doesn't work. So in that case, you have to see the doctor and get a stronger painkiller. And pretty much that's it. If you have any questions and if you want to know more about like paracetamol, ibuprofen, and painkiller in general, you can just send me a comment and and I may able to help. Thanks.